I'm Grace. I'm the physician assistant student today. The purpose of this physical examination is to do a general survey of your health, to collect your vital signs, and do a physical examination of your head, ears, eyes, nose, throat, and neck. If you could go ahead and remove your shirt, shoes, and your socks while I wash my hands for just proper visualization, we can begin. All right, I am noting the patient's presenting appearance and general health status. I'm assessing that the stated age correlates with the apparent age. I'm noting the hygiene and grooming status, especially noting for any bad breath or any body odors. I am noting the patient's body habitus, motor activity, the posture of the patient, as well as as for any physical obvious deformities. I am noting the facial expression of the patient to see if it indicates any acute signs of pain or distress. At this time, I would conduct a mental status examination. Also at this time, I would collect height and weight of the patient. And for now, I will begin by collecting the body temperature using an oral thermometer / thermostat. I will use a guard, place it over the thermometer. Then I will turn the thermometer on, place it under the patient's tongue, wait for 1 minute to elapse or until the thermometer beeps. Alrighty. Alright, next I will use the index and middle finger pads, and I will go ahead and palpate for that radial pulse. I am determining the heart rate by assessing the rate, rhythm, and amplitude of the radial pulse, counting for 15 seconds using my stopwatch, and then multiplying that number by 4. Perfect. And then at this time, I will also ensure that there is adequate exposure of the chest, and keeping the palms of the pads of my middle and index finger on that radial pulse. I will also check for the rate, rhythm, and depth of respiration, ensuring there is adequate visualization of the chest, counting for 15 seconds and multiplying by 4. Perfect. Next, I will assess the patient's blood pressure. First, I will grab the bladder of the cuff and ensure that the width of the bladder is 40% of the patient's arm circumference, and the length of the bladder is approximately 80% of the arm's circumference. Then, I will palpate and feel for the brachial artery. I'll place the cuff 1 inch above the antecubital fossa, ensuring that the artery index marker is aligned with the brachial artery. Next, I will determine the palpable systolic pressure using the pads of my index and my middle finger to feel for that radial pulse. I will pump up the cuff until I can no longer feel the palpable radial pulse and note that number. I will deflate the cuff. And now I will measure the systolic blood pressure by adding 30 millimeters mercury to the palpable systolic pressure that I got. I will raise up the arm. Now, what I'm doing is I am listening for the onset of the first Karatkoff sound, which will indicate the systolic blood pressure. And then I am going to slowly release the dial 2 to 3 millimeters mercury per second, and the cessation of that Karatkoff sound would be the diastolic blood pressure. All right, I'm going to pump it up 30 millimeters mercury above that palpable systolic pressure. On the opposite arm, seated. And if necessary, I would also perform the blood pressure reading test in a standing and supine position. Now I'll be conducting a skin examination. I'm going to go ahead and ask the patient to stand up. Could you go ahead and stand up for me? Perfect. I'm noting for any pigmentation or any areas of discoloration on the face and the skin in general. I'm going to go ahead and have you lift up your pant legs. Perfect on both sides. Perfect. Show me the soles of your feet. Perfect. Now I'm going to be palpating for any moisture, temperature, and texture using the back of my hands. And then turn around for me. And as well as in the lower extremities, bilaterally. Turn around, please. Perfect. And then next, I will also palpate for turgor and mobility. And I will do this bilaterally as well. Please turn around. Please turn around. Next, I will now look for the fingernails and toenails of the patient. And I am going to be inspecting for any clubbing, brittleness, cyanosis, lesions, and lines. Perfect, and I'm gonna press down on them as well as for the toes. Perfect. All right, and that concludes the skin examination. Now I'm going to be examining the skull, the head, and the scalp of the patient. So first, looking directly at the patient, I'm noting for any skull deformities, I'm noting for any masses, noting for any asymmetry, any potential tenderness. I'm noting for, now I'm going to look through the scalp to look at the hair growth, hair texture, growth patterns. I'm also going to be looking for any lice, nits, lesions, and dandruff. And then I'm going to palpate the scalp as well, just for mobility and any tenderness. And the scalp is the movable portion, while the skull is immovable. Alrighty, and now I'm going to be inspecting the face. I'm going to note for any edema, any lesions, any deformities. Perfect. Alrighty, and then now I'm going to be inspecting for the temporal arteries. I'm going to palpate on them. So palpating those temporal arteries, I'm going to check for pulsation as well as tenderness. And then I'm going to move to the temporal mandibular joints for any crepitus, tenderness, and deformities. Please open your mouth, close, extend side to side and forward and back. Perfect. All right, next I will be palpating over the forehead, the supraorbital ridge, the zygoma, and the mandible. Alrighty, and then lastly, I'm going to be palpating over the parotid gland. And I'm assessing for any edema or tenderness, which, perfect. All right, now I will be moving on to the next portion of my examination, which is the eye exam. All right, for the eye examination, I'm going to be first looking at the eyebrows, the eyelids, and the eyelashes. I'm noting any asymmetry, I'm noting any lesions, and I'm noting any erythema. Next, I'm going to ensure the position and closure of the eyelids is proper. Can you go ahead and close your eyes for me and open? Perfect. Next, I am looking for the bulbar and palpebral conjunctivae, looking for any injection as well as discoloration. Go ahead and look down. All right, and look up. Perfect. Now I'm noting the color of the sclera, ensuring that it is indeed white. I am also noting for any potential injection or blood in this area. All right, perfect. All right, now I'm moving on to the palpating for the lacrimal duct. I'm palpating over the lacrimal duct for any tenderness. I'm attempting to eject any discharge from that nasolacrimal duct and palpating for tenderness. If there's any edema. Perfect. All right, now I will begin to test for visual acuity. So what I'm going to have you do is I'm going to have you hold this card, the Rosenbaum eye chart, in your right hand and cover your left eye. All right, and read the lowest line.
3, 7, 6, 4, 8.
And switch sides. Read the lowest line.
5, 6, 3, 2, 9, 7.
And now with both hands.
5, 6, 3, 2, 9, 7.
Perfect. All right, now I'm going to be measuring your pupil size and symmetry. Alrighty. Next, I'm going to test the visual fields by gross confirmation. All right, so I'm going to have you hold your fist in front of your chest and raise a finger as soon as you can see my fingers in your visual field. So I'm going to test for superior peripheral vision. I'm going to test for lateral. I'm going to test for inferior peripheral vision. Perfect. Next, I'm going to be doing some procedures of accommodation. I'm going to have you look at a wall. Look at the point on the wall right there, and then you're going to focus your eyes on my pen once you see it. Perfect. And then now I'm going to do convergence. So go ahead and follow the tip of my pen. Perfect. And then as well as lip lag, going from down to up. Perfect. Alrighty. Now I'm going to test your extraocular movements in the 6 cardinal directions. And while doing this, I'm also going to check for nystagmus. Please follow my pen. Perfect. And ensuring that your head is not moving and it's just your eyes tracking my pen. Wonderful. Next, I'm going to be checking for tangential lighting. Now I'm going to shine the light to visualize the cornea. I'm also going to be assessing the anterior chamber, the depth of that anterior chamber, as well as noting any crescent shadowing in the medial aspect of the eye, and I'm going to perform that bilaterally. Perfect. Next, I'm going to check for direct and consensual light reflex. All right. Direct. Consensual. All right, now other side. Direct. Consensual. Perfect. Pupils did constrict. Now I'm going to be performing the fundoscopic examination. ensuring that my light is on and that my finger is on the diopter and the wheel is starting at 0. Alright, and I'm going to be performing this test bilaterally. I am checking for the symmetry of the corneal reflex. Perfect. Perfect. The corneal light reflex is all intact and symmetrical. Next, I will move 15 inches from my patient and 15 inches from the midline. And I'm going to assess the red light reflex. I'm going to start my finger on 0 and keeping it on the diaphragm. I see the red light reflex. Then I'm going to come closer. And I'm assessing the optic, I'm assessing the canal as well as its margins. I'm assessing the the optic disc and its margins, the disc to cup ratio, as well as the retinal vessels and arteries and general condition. Go ahead and look into my light. I have visualized the macula and fovea. Sorry, I had to do it. And next I will do the same thing on the other side. I have found the red light reflex. I see the optic disc, the cup to disc ratio, as well as I'm able to visualize the retinal arteries and veins and condition. Please look at the light, and I see the macula and fovea. Alrighty, and that concludes the eye examination. Now we'll be moving on to the ear. Alright, I'm ensuring proper size of the speculum, turning on the light. Perfect. I'm going to use my pinky as a fulcrum for stability as I look into the external ear. First, I'm going to palpate the auricles bilaterally before I begin. Perfect. And I'm assessing for any discharge, any lesions, and any deformities. Now, I will also palpate the auricle, the tragus, and the mastoid for any tenderness and edema. All right. And I'm actually going to begin a whisper examination first. So I'm going to cover your tragus, and then you're going to have to go ahead and tell me what two-syllable word you hear. Crunchy. Crunchy. And now other side.
Squishy.
Yeah. Alrighty, now that that is done, now we can begin visualizing the external ear canal. I'm going to pull up your auricle upwards and outwards. I'm going to use my pinky as a fulcrum for stability. And I'm going to visualize the external ear canal. I'm noting for any cerebrum or cerumen. I'm noting for any foreign bodies, inflammation, or edema. Alright. And I am visualizing the tympanic membrane for color, as well as the contour is a pearly gray. And I am able to see the tympanic landmarks as well. The tympanic landmarks are the malleus, the cone of light, and the umbo. And I'm going to do that bilaterally. Using my pinky as a fulcrum, pulling the auricle up and outwards, and visualizing that tympanic membrane pearly gray once again, and all of its landmarks. Perfect. And that concludes the ear examination. Now I'm going to change out the speculum and ensure that it is the correct size, and we will go ahead and get started on the nasal exam. I'm checking for any obvious deformities of the nose. I'm going to palpate for any tenderness. I'm going to have you cover your right nostril. Breathe out, breathe in. Same thing, breathe in, breathe out. All right, and that's for nasal patency. Next, I'm going to use this. I'm going to put it upside down. I'm going to check your nasal mucosa. Once I visualize your nasal mucosa, I'm also checking for any nasal septum deviation or perforation on both sides bilaterally. And then I'm also going to be checking for the turbinates for polyps bilaterally. All right, that concludes the nasal examination. Before I begin on visualizing the neck, I'm lastly going to check for the sinuses. I'm going to check and palpate for the frontal sinus and the maxillary sinus. All right, now I am visualizing the neck. I am noticing that there's no masses. I'm noticing that there is no thyromegaly. I'm noticing that there is no jugular vein distension, and that the trachea is midline. All right. Now I'll begin the oral examination using a pen light. I'm going to put on my gloves now. I'm going to use gauze and a tongue depressor as well. Okay. All right, we've got the gauze as well. I am checking for the general status and observing the nasolabial fold. I'm observing the lips. Please open your mouth. I'm observing the buccal mucosa. I'm observing the floor of the mouth, as well as the gingiva and the teeth. Now I'm going to have you go ahead and open your mouth. I can visualize the oropharynx as well as its tonsils. I'm going to have you say "ah" for me. And I am visualizing, hearing the phonation as well as visualizing the rise of the uvula and the palate. Perfect. Now I'm going to be assessing for any inflammation. There is no inflammation, no masses, and I am also going to be assessing for the general dentition of the mouth. It all looks good. Now I'm going to have you go ahead and open your mouth and stick out your tongue. I am noting that the tongue is of good color and it is situated midline, as well as the texture is good. All right, and now I'm going to use the gauze, grab the tongue in the middle with my non-dominant hand, and palpate on the sides for any induration or tenderness. And the other side. Perfect. Next, I will check for the thyroid. I have visualized the thyroid and there are no masses, there's no lesions, and can you go ahead and swallow for me? Perfect. Now I'm going to assume position behind the patient, put my pinky on her clavicle, and then palpate for that thyroid and isthmus. Go ahead and swallow for me. All right, and once I've palpated that isthmus, I'm going to now displace the trachea and feel for the left thyroid gland. And now on the other side. Swallow. Thank you. Thank you for swallowing with all three positions. Now what I'm going to do is I'm going to assess for the lymph nodes. All right. The pre-auricular lymph nodes using circular motion, post-auricular lymph nodes, the occipital lymph nodes, the submandibular lymph nodes, the tonsillar lymph nodes, the palpating for the submental lymph nodes. I'm also going to be palpating for the, turn your head to the left please. Perfect. I'm palpating for the pre-cervical lymph nodes and the post-cervical lymph nodes. Circular motion. Other side. Pre-cervical lymph nodes and post-cervical lymph nodes. Alright, now I'm going to go ahead and have you touch your right ear to your right shoulder. And I'm going to palpate for those deep lymph nodes. And other side. Deep lymph nodes. Alright, lastly, I'm going to have you take a deep breath in. I'm going to place my fingers above your clavicle and palpate those supraclavicle lymph nodes. Alright, and that will conclude this exam.